Hi, I'm Beth Reasoner. I'm the Infection Control Manager at Boulder Community Hospital, and I'm talking to you today about the initiatives that we have implemented over the last couple years to prevent the occurrence of central line-associated bloodstream infections in our hospital. And the first things we have done are the implementation of what we call the basics. And the first basic is excellent hand hygiene. We have a rigorous hand hygiene program here at Boulder Community Hospital whereby we monitor our staff every shift once a month and submit that monitoring data. And we are proud to say that we've had over 95% compliance with hand hygiene through the year of 2009. The second thing we do to prevent central line-associated bloodstream infections is maintain excellent transmission-based precautions for any of our patients who have infections that could be transmitted. Staff have particular protocols that they're required to follow, and we ensure that they are following those protocols and that they're supported in doing that. The third basic that we do is patient equipment cleaning, and this is specifically in regards to how the equipment that roves from patient to patient is cleaned between each patient. All staff, regardless of their position, are required to be involved and know how to do this, and we have made great strides in implementing this in all of our inpatient care units. Now, when we talk about central line-associated bloodstream infections, we're talking about a category of infection called device-associated infections. Anytime a device, like a tube or a line, breaks the skin and enters the body, it becomes a pathway for microbes to enter and potentially infect that patient. So we take extra precautions when a device is in a patient. The things that we have implemented over the last 2 years to prevent central line-associated bloodstream infections include the use of what we call a central line insertion checklist. The checklist is filled out with each central line insertion, and it is maintained on the patient chart so that anybody looking at that chart knows that every step that was required was completed for that patient's central line insertion. To go along with the central line insertion checklist, we developed what we call an insertion kit. The kit drives compliance with every item on the checklist, and those things include that we choose the correct site for an insertion or the preferred site. There are some sites that are more likely to cause an infection than other sites, and if at all possible, we want to use the less high-risk site. That's one thing we do when we mark on our checklist. The second thing we do is we clean the site with chlorhexidine, which is recommended, and allow that to dry. And as we're doing all of this with the insertion, we're sure to maintain full barrier precautions, which means full sterile precautions when we're inserting a line. And all of our staff and physicians have been trained to do that when they're inserting a line. Finally, what we do is we know that the longer a device or line is in a person, the higher the risk is of getting an infection from that line. So we have implemented a process whereby every day, anyone who has a central line in place has that line assessed as to whether or not it still needs to be in. And there is a place where the nurse actually documents that that assessment was done and the line was removed as quickly as it was no longer needed. The other thing that we have done is what we call a Scrub the Hub campaign. Scrub the Hub is about cleaning any access port to a central line for a 15-second frictional scrub, and we use chlorhexidine for that here at Boulder Community Hospital before we inject anything into a central line. The next thing we have done is we have implemented a central line dressing change kit. The idea being that every central line dressing is changed under sterile conditions using the same techniques regardless of where that patient is in our hospital. And we've done intensive training with our nurses to ensure that they all know how to do that. So the data that's presented to the public is in a diligent effort to help the public understand what hospitals are doing and how successful they are in preventing infection. The problem is that it's a very complex issue and very difficult in a simple chart to explain all of that. So what does the public do when they need to know more about what a hospital is doing in regards to specific infections? The first thing they can do is check out the hospital website and look and see that they have a good infection prevention program that's headed up by a nurse who is certified, nationally certified in infection control and epidemiology, as well as a physician who specializes in infectious disease and epidemiology. If they have more questions, specifically about a surgeon, perhaps they should speak directly to that surgeon about what their infection rates are and what they do technique-wise to prevent infections. And then the third thing they can do is call the hospital and ask to speak to someone in the infection prevention department so that their specific questions, whether it's about MRSA or about C. diff or about a surgical wound infection, can be addressed one-on-one.